Dr. Oz, it is a thrill to be with you again, sir.
Chris, God bless you for having me on.
Of course. I was talking with Callie Means a little earlier today. We were just talking about the work that you're all doing, the thing you all share in common. I was just bragging on you all. Masterful communicators. You just are. President Trump values the art of communication as much as he values the work you do.
Well, you're kind to say that. The president is very wise about the reality that you need other people to carry the water sometimes. So if you've got a good story to tell, in my case about Medicare and Medicaid, then go out there and tell it. Why would I burden the president with having to tell all the tales that need to be told about why something as big as healthcare needs to be paid for differently? And he has done the same thing with Secretary Kennedy, who was a very close friend of mine, and just brilliant at his ability to just connect with people. So when you hear him speak about controversial issues, you stop for a second. And you just start to listen, and maybe a little bit of it changes how you feel, which is, again, we're all in the change business in this administration. None of us came here just to babysit the process. So he wants that. Marty McCary, who runs the FDA, brilliant communicator, very influential in the healthcare field. Jay Bhattacharya at NIH, all these guys. When we sit and do press events together, I just marvel at them. I mean, I just sit back and enjoy the words of wisdom, the poetry coming out of their mouths.
You're no slouch yourself, by the way. You're being modest, but you know that. Let me ask you about the way in which you all have talked about this. Your subject matter in particular, Medicare and Medicaid, it is probably the most vilified and politicized item in all of government. Democrats love to use the threat of Republicans killing grandma and grandpa and not giving them their medicine and all those things. That's got to be maddening, because I know who you are and I know what you're trying to do. You're not trying to extinguish Medicare and Medicaid, but
we're trying to save Medicaid. And the president was very clear on this over and over again. And he would call me up and say, Oz, just get the fraud, waste, and abuse out. That's what we tried to do in the One Big Beautiful Bill. And it is, to me, frustrating, alarming that others would construe that as purposely trying to hurt the program. If you looked at what happened during COVID, there was a desire to use Medicaid to catch a lot of problems and pay for them. Well, in an emergency, okay, fine. I'll look the other way for a little bit. But once the emergency ended, the public emergency was called to an end in 23, you've got to put the rules back into the system. This is true of Medicaid and the exchanges and Medicare across the board. And we didn't touch Medicare at all, but it was pretty clear that if we did not intervene on Medicaid, well, we basically had legalized money laundering taking place and tremendous amounts of fraud and people on the program who were never supposed to be on the program.
Stunning number of able-bodied men, as I understand it, on Medicaid in particular, true?
It is shocking for a bunch of reasons. First reason is 60 years ago when Medicaid and Medicare were both founded, there was no idea, no concept that you would ever have able-bodied people on Medicaid. Medicaid was for, as Hubert Humphrey said, it's a moral obligation, he argued, of government to take care of those at the dawn of life, the children, those at the twilight of life, the mature folks, and those living in the shadows. That use of light as an allegory is haunting, but it's important. Dawn, dusk, and those in the twilight, in the shadows. But it's not really about able-bodied people who are in the bright, sunny days of their life, sitting at home and watching on average 6.1 hours of television or just hanging out. It's actually not what God put you on the planet to do. You're supposed to go out and make the world better. So the president said, and Congress supported him with passage of the bill into law, we want you to go out and volunteer, get an education, get a job. We'll make it easy. We'll help you do those things. But you've got to get out of the house. Otherwise, we have generational poverty. We trap people in this, but they think we're building a little fort around them. It's not, it's a cage. You're boxing them into a life that they can't get out of. And if you don't start working, at some point you get depressed. The high incidence of opiate use, depression. So what the president wanted to do is what most Americans wanted to do, which, 3/4 of Americans are supportive of this idea of getting people who can work to work. That's the kind of thing that also happens to save Medicaid. And there are other things that happen that I could bore you with for hours, but one of the things that was most frustrating is a rule was made last year that allowed states to pay 3 times more for Medicaid patients than for Medicare patients, which means if you're a Medicare person, who's worked your whole life, paid into the system, you'd have to wait theoretically behind a Medicaid patient who was not working because they would reimburse a doctor 3 times more. Well, that's not fair, right? So all we said was make it equal. And you know what? That's what Obama had. We just took it back to beyond, before last year or before the pandemic. And the fact that that will be controversial is stunning to me because we got big fish to fry. We have major challenges to the health of the country. The Maha movement was about that. We should not be pretending that this is hurting America when the reality is that we should be focused on how to get our young people healthy, to deal with the autism catastrophe, and reduce overall health expenses by being smarter about how we invest our money.
Have doctors been more or less forced, the business model, been forced to play, if you will, to Medicare and Medicaid in terms of the way they bill and the way hospitals and doctors' fee structures are set up? Has that been deleterious, ultimately, the way people practice medicine in the country?
There's no question that when you pay for things, people do those things. If you pay for them to do extra procedures, they'll do extra procedures. And Chris, you asked a very important question. We control about $1.75 trillion of expenditures at Medicare and Medicaid. That's twice the size of the Defense Department. That's how big this is. If we pay for the wrong thing, we'll get the wrong outcome. It is imperative for us not just to pay the bills, but pay the bills for the right types of activity, preventing illness, and mental health conditions that otherwise would lead to all kinds of untoward events, making sure that we're taking care of kids and moms who are having babies. That's where the money should go. We need more primary care doctors in America. We need more nurses. What I don't need is throwing really expensive solutions that people don't want them or need them, and then paying extra to the people, doctors, hospitals, whatever, doing those procedures that may not be in the best interest of the patient. And those are the kinds of difficult decisions that you want your health guys to make. And we have excellent people in the organization who have domain expertise, who know the challenges and are aggressively moving to fix these problems. The president has already allowed us to do something around prior authorization. So we don't have insurance companies interfering with your ability to get the care you want from your doctor. This is infuriating to patients. When they have insurance, they go to a doctor, and the doctor says, well, you need to have your knee looked at, but I can't do it because you don't have, your insurance company hasn't approved it. We have a plan now for most favored nation pricing on drugs, so Americans should not pay 3 times more for the exact same drug made in the same factory, in the same box, as someone in Europe is paying. That's not fair to the American people, and drug companies shouldn't do that. And they know that, so someone's got to call them up and say, hey guys, we're on to you. We know you don't want this. You went in this business because you care about people. And just don't forget that reality. Go back to your roots. Let's make these systems work. Right now in America, 1 in 3 patients who goes to a pharmacy does not pick up their prescription because they can't afford it. They've got to choose between food and drugs and prescriptions. And so that's not a good place to put the American people. The president wants those issues addressed, and we have the money to do it. We're spending twice as much as any other country on the planet. We just got to use the money more thoughtfully.
Just briefly on Medicare. Medicare, for seniors, it's critical. Everyone cares deeply about Medicare specifically. What would you say about the state of Medicare? Seniors who are on it, should they be concerned about it? Should you ever listen to politicians who claim it's being attacked?
We are not in any way reducing expenses or investment in Medicare. What we are going to want to do is make it more efficient. And that's primarily to help seniors get better quality care. Chris, I'll share a little secret with you. The most expensive medicine is bad medicine. The better care you get, the better you're going to do personally, but the less you're going to cost the system. And the reason is because if you get a bad operation, I've got to pay the doc who did the bad operation. Then I got to pay another good doc to fix the problem, and I got to pay for the complications. That's all expensive. So let's just get it right the first time. And I think that's how we think about Medicare. So much of what seniors in America want, the care they want when they want it, and with the kinds of comprehensive support that they desire, it's out there. There's some parts of the country that do it well and some don't. Our job is to make sure we remind people who are failing that they could do better, and then to appropriately compensate or not, depending on what they're doing.
You've been good with your time. So last question, I'll just close with this. Broadly speaking, in this arena of the MAHA movement and HHS, what do you think so far in just 7 months, there have been massive changes. What do you think is going to be the lasting legacy of those of you inside Medicare, Medicaid, HHS, the consortium of all of you, NIH? I mean, already massive things have happened. Who knows what's to come in the next 3.5 years, but is there something you point to right now as I didn't see this ever happening and it's happened?
The holistic approach to making sure government works for people, especially in healthcare, is something that I did not know for sure was achievable. I am positive now that we can get some of the special interests out of the way. It turns out a lot of them don't want to be in the way anymore. So they're starting to come on board in a very big way, and the power to convene that the President and Secretary Kennedy have given us has been incredibly successful. Listen, you can pass a law, hard to do these days. You can pass rules and regulations. It's painful. People challenge it legally, and it's oftentimes you don't get the goal you really want, because the people who really know how to fix their business are the people in that business. So why not get them to do it under threat that if you don't do it yourself, we'll come in there with a sledgehammer. But you guys can nimbly make your systems work better. Go do it. We'll give you air cover. We'll make sure we protect you. And if you don't do it, we'll come after you. And that is working.
Doctor, it's been a real thrill to see you in person. Thank you for the work you're doing on behalf of all of us.
God bless you, Chris. I appreciate all the support. Thank you, sir.